Okay, so with that, we're going to go into these two presentations today. The first of which is going to be some diagnoses that you don't want to miss. So when we do these for like our residents and fellows in our training programs, we generally pick a lot of weird and wonderful things, and I don't know why that is. I think that's just kind of like part of academia. But what I picked here was things that are not weird intentionally, actually things that are like pretty common, where I think that you can make a difference in the patient's care. So the idea here is not for these things to be so esoteric. We'll talk a little bit about the differential diagnosis, and I kind of hopefully set up this first presentation to be a bit on the slower side so you can feel completely comfortable with it, either through the main portion of the presentation or through the Q&A portion. So no conflicts to disclose. We're going to use a case-based discussion format, and we're going to go through 6 diagnoses. These are cases that were sent to me or were sent to our practice, and they were a surprise, right? So the original pathologist who had the case, and once it came to my attention to our group, they were surprised about the diagnosis. And so these are 6 things that I think you could recognize and would be helpful. A number of these are actually reactive. They're not malignant, but there's actually a treatment available for them, and so that's a useful thing to appreciate. So the first one is a 38-year-old woman with dyspepsia and a normal endoscopy. So in our institution, that's going to trigger a biopsy, right, and in many places in the US. And so this is an example of what her biopsy looked like. This is some sections from that biopsy, and I think right away you can see what's at work here. And a crucial thing I think about the GI tract and the liver, and the same thing is true for the pancreas, is that having a systematic approach guarantees that you will see everything that there is to see. It doesn't mean that you'll get the right diagnosis or right specific diagnosis, but you will see the abnormalities, and I think that that's a crucial first step. So when you look at this particular case, you can see that this is kind of almost like pancreatic acinar metaplasia. You got these foveolar pits, but if you look here in the lamina propria, you'll see something. Kind of a cellular infiltrate. We get a little bit closer to it. So there's this kind of what I think is intracytoplasmic mucin and some eccentrically placed nuclei right here in the lamina propria. Here's a keratin stain, and the jig is up now. We have an intramucosal carcinoma. Pretty discohesive. Here's some additional pictures kind of like looking at this sample now from the resected specimen. You can see some nuclear atypia here. What I said is pretty convincing nuclear atypia. And there's in other areas of this resected specimen, very, very convincing in this funded mucosa. I did a picture of a mucicarmine to show you because I thought that it looks really good. It highlights the intracytoplasmic mucin, the eccentrically placed nuclei.